Welcome back to DESCareers at Dubai English Speaking College. I am so excited to be on the road again, and today we are meeting with Dr. Manos from the Modern Veterinary Clinic here in Dubai, JVC, where they've opened a new branch in November of 2020. Dr. Manos is going to be offering us a live consultation with our very own Kiki so that our aspiring veterinarians can learn what doctors do when they are treating furry patients just like Kiki, and to learn a little bit more about what he needs to be preparing for when he is going to be consulting with furry animals. We're going to be talking about some of the illnesses, some of the challenges that he has to face when he's looking at dogs and cats, and we're also going to be learning a little bit more about Dr. Manos and what he did before becoming a veterinary doctor here in Dubai. Welcome, Dr. Manos.
Welcome to JVC.
It is so exciting to be here. I know we've had a few spotlights. You've come to the college. We even set up a Modern Veterinary Clinic way back in, I believe it was 2017.
And I brought also Bowie.
You did.
My
You
Great
brought
Dane.
your Great Dane.
I still have the pictures, everything.
And it was so much fun, and we've had you at the college for speed spotlights. We've done spotlight interviews. But this is our very first bringing our own Kiki to you so that you can be offering us a live consultation and talking to us a little bit about what you do and how young aspiring veterinarians can prepare. So before we get into the actual consultation, of course giving Kiki some time to digest what's about to happen, let's talk a little bit about you and your training and what brings you to Dubai. So take us back to those younger years when you were 16 and 17. How did you know that you wanted to be a veterinarian?
I just challenged myself because I just wanted to be a doctor, human doctor. And then I decided that instead of something simple, it's not. I want to challenge myself and do something more difficult, like being a veterinarian. And the challenging is that your patients are not talking. You have to interpret any action of them. You have to understand what the owners are telling you, and what is the physiological and what is not. So it's a little bit tricky, but it's nice.
What kind of training does a veterinarian have to go through that young people might not be aware of?
University, vet university, depends from the country, pre-vet, vet, if we're talking about states and all the stuff, and the veterinary university in the rest of the Europe. And then depends what you want to do, because now we have specialties for everything, like human doctors. In main branch we have a cardiologist specialist, we have a neurologist specialist. So from now on the veterinary profession is going to be more strict and more demanding. So where the general purpose, the GPs, and we have the specialists that they are just focusing in one system, in one problem, and this is the good stuff because we can refer, we can have a second opinion that is very useful for us, and of course we're learning.
Would you say that training as a veterinarian would be as competitive as training in any other medical field?
More than any other field.
Talk to us a little more about that, because I think young people are not aware, and I think sometimes they think, well, I want to be a real doctor, but we know that being a veterinarian is also medical training, and I believe you go through the same number of medical training years that you would.
Okay, let's begin with the fact that we are not focused in one species like human. We are focused in many: dogs, cats, avians. It's amazing. You have to learn things that you couldn't even imagine. That's why I'm telling you that after university and when you want to continue your knowledge, your science, you're taking the specialties, so you're going to be focused with only something. Last 2 weeks we had the first cardio surgery in the main branch. This is something very exciting. The first cardio surgery in UAE was done in MDC, the main branch. It's already published in Khalid's News. The cardiologist is going to give interview in Dubai Eye, day after tomorrow. It's a very good thing that it could happen. It happened, and it's under our wings. It's under Modern Veterinary Clinic.
So you mentioned that one of the biggest challenges is that your patient can't talk to you, and there's a lot of trying to understand.
And don't forget that when mothers are taking their children, their babies, to the pediatrist, the doctor is informed about everything with seconds. So you're going to say that my baby had cried at 10:02, has done that 10:03. Here, because we are working, we're not living with them 24/7. We cannot really know what's happening 24/7. So it's what you have seen on spot and what we can see, and we have to combine the information that you are giving with what we are feeling. And then it comes differential diagnosis. Differential diagnosis means that you cannot say that, oh, Kiki has this or Kiki has that. You're going to say that it could be this, it could be that, and you're going to take one by one and eliminate till you have the diagnosis. This is the tricky part, and of course sometimes our patients are not compliant with what we're doing. They are screaming, they are biting, they are fighting. And this is not nice for the owners, the parents, as I usually say. Because when you see Kiki screaming, you're going to feel something, that something is wrong and something's not correct. But this is the procedure.
What would you say to a 16 to 18-year-old right now who's thinking about going into veterinary science? What should they be preparing themselves for?
That they have to study 24/7. It's very hard. If I'm not mistaken, till now, the veterinary universities are the toughest one. Correct? As an expression. Yeah. So they have to just focus with what they want to do. If you don't want to be a veterinarian, don't even start studying. Okay, you have to be focused 100%. But it's a job that at the end of the day, it gives you such a joy. It's amazing.
How can a young person gain experiences if they are thinking about going into veterinary science?
Depends. If they have pets at home, let's begin with this one. Okay, they're gonna have something, an experience. I believe that the system here is a little bit difficult because we used to have, if you remember correctly, a few students from your school attending for a few days just to see how the clinics are working, blah, 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 blah. But because of the municipality rules, laws changed, it's very difficult now to have guests. But I have learned that in UK, for example, they have colleges for summer training that they're accepting students to see and live this environment. They can see how the system is working and how the veterinary school is working and what they should expect from their studies. And I have clients that their children have been already, or they could attend zoo. Again, I don't know here, but there are places and facilities that are accepting students for few days or weeks during summer or during their vacation to help the staff there so they could actually have a hand-on experience with all these things that we're doing.
When we think about work-life balance and we think about a career and how it has an impact on our personal lives, what would you, or how would you describe being a veterinarian in relation to having a family or also having a life outside of work? Would you say that it's a highly challenging, highly...
You have to balance everything. It's not challenging, but you have to balance everything. So, my needs are 1, 2, 3. What I can do? 1, 2, 3, 4. You have to balance in between your needs and your daily life. So if you can find the balance, everything is perfectly fine. Yes, it's exhausting. Sometimes I'm going home and I'm just fainting. I cannot even move. But this is the nice part.
What type of work hours would you say are average
There
for
is,
a
there, is,
veterinarian?
there, is, there is no average, unfortunately. We have a shift of 8 hours, but sometimes I have to stay here for 10. So for me, it's indifferent. But when I'm doing overtime, I'm happy because I know what I'm doing and why I'm staying more. And it's a productive time. All these 8 or 10 hours, or as many as I have to stay.
And what type of character strengths should a young person be enhancing if they want to be a veterinarian?
Ice cold character. That tough.
Would you say that that is because the individual and the career are ill-matched, that they're not the right match, or would you say that it's just a highly emotional career because the animals are very vulnerable and we get we're unable to really understand and we take it on very personally?
I cannot answer. It's a combination of things. But at the end of the day, when you finish your work and you give your shift to the next shift, you have to be sure what you have done, and you have to smile. So if you're getting stressed that you have done something wrong, or if you could have done something different, and you're getting so stressed, yes, they are fragile, they're vulnerable, but you have to be strong. Otherwise, you shouldn't be a vet. It's exactly the same with human doctors. If you start thinking, oh, this one died, or this one is going not well, or this one went perfectly fine, and you're going to get crazy. No, everything has to be balanced. Okay, I'm talking with my experience of 25 years. This is different. Okay, so now I can say everything. And for me, it's very easy to control my emotions, my feelings, my everything, my thoughts. It's very hard. Regardless your science, always you have to be as balanced as you can. And at the end of the day, you have to smile. You have to be happy with what you have done. And I usually say, I don't care. This is also regarding my daughter. I don't care if she's going to be a plumber or a human doctor or a vet, but she's not going to be. Whatever she decides, she has to be happy. That's it. Otherwise, she's not going to be productive. She's not going to be good with what she's dealing with.
Okay, so I can sense that Kiki's getting a little anxious. I can hear cats crying in the background. Let's jump into the consultation, but to put it into context, what we're going to be doing right now is a real life consultation. Kiki feels it. It's about to happen. This is our first time working with an animal at a spotlight, so anything can happen right now. But Dr. Manos is going to be taking us through a very common consultation when we bring our pet in and there are no physical or any kind of emergency issues. So we're just going to be talking you through what you do. So when a patient comes for a regular annual checkup, that's the first thing, is what does a veterinarian, what's on the list of things to be looking at?
So first of all, from the system, we know about what the problem is. So let's say that Kiki came today for her vaccines, annual vaccines. Okay, nothing serious. So we're going to have a general consult. We're going to check everything, that everything is perfectly fine. I'm asking the owner, the parent, a few things just to be sure that everything is fine. And then we proceed with the injections and everything.
Okay, but
So,
there will be no injections
no
today.
injection
No
today.
injections today. Kiki's
So
only
the
taking one for the team. She's here to help our aspiring veterinarians learn behind the scenes. So Kiki, everybody at Dubai English Speaking College thanks you for your patience. So I'm handing over Kiki.
So
Tell us what you're about.
I open her file. I know her previous weight, everything, her medical history. So the first thing, I have to check her weight. let's see how Kiki is doing today. Kiki, stay calm, please. 142. So Kiki last time was 1 kilo and 280 grams, and today she's 1 kilo and 420 grams.
Kiki put on some weight.
I'm making notes directly.
So Kiki put on some weight. Is that normal for
Yes,
a
of
dog
course.
to be putting on that kind of weight?
Of course.
So when would that be a red flag that the veterinarian would
Depends from the body score.
tell us more?
The body score is we're checking the weight and if there is any extra fat or not. So they could be normal, like Kiki. They could be overweight, obese. They're getting like huge, and underweight. So when we're talking about underweight pets, where it means that we can feel the ribs, we can feel the spine, and of course it has to do, if it is not something pathological, it has to do with feeding, the food in general. So now Kiki is doing perfectly fine. So we have to check the teeth, the mouth, the eyes, the ears, the skin, the coat, the temperature, of course, but she's not gonna like it.
No, Kiki doesn't like that. So when you're checking the eyes, the ears, what are you looking for? What are some of the things that...
Something that's not normal.
What would not normal be?
Conjunctivitis, for example,
Okay.
or ear smell, weird smell, or any kind of discharge from the ears.
Okay. So in training, when you were learning to be a doctor, did they, so for example, just picking up on, you said like a strange smell, would there be training to understand what that strange smell would be? Or is
No,
it
we have to check. We know if we see anything in the ears, for example, we have to use the otoscope. We're checking inside, we're taking a smear, we're checking in the microscope, we're saying that, oops, there is cocci or rods or bacteria or malassezia or whatever, and we're giving the treatment that they need. For the eyes, if we have a discharge, yellow, green, whatever, and the eyeball is getting reddish or the eyelids are getting swollen, that means that we need to give eye drops. So, please.
There we go, Kiki, back to the doctor.
Thank you. So
tell us what you're doing right now.
I'm checking the mouth and the gums and the teeth. And Kiki has a wonderful, wonderful smile. Whoops. I know that you don't like it. There is no tartar, no plaque, no nothing. The mouth is perfectly fine. So, eyes, perfect, no discharge, no redness, no irritation.
So teeth, mouth,
Ears.
ears.
They look perfectly fine. I'm going to use the otoscope to check them inside. Otoscope.
So you started with the weight, then you check the facial features, and then you go into the ears. And by now, this is a typical consultation session. So if you're a student thinking about going into veterinary science and you have an animal at home, a cat or a dog, Dr. Manos was saying you can use that opportunity to start to get to know what it's like to be a vet by using your pet as an example. Of course, be gentle.
I did the same.
Don't
with
stick
with my
anything
pets.
in their ears or their mouth, but just start to get
When I was studying, I was sampling blood from my dogs just for the experience.
But definitely don't be doing that. We don't want anyone taking
When I was
any
studying vet medicine.
at veterinary clinic. Okay. So right now you're checking her ears.
Yep. So, wow.
What does wow mean?
Perfect.
Oh, okay. Kiki's doing well so far. Well done.
Wow.
I think she's gonna
More
get
than perfect.
she's gonna get a nice treat at the end of this.
So, we completed the head, chest.
So tell us what you're about to do now. We're turning her around.
Yes.
What are you going to be checking?
I'm going to check the heart, the lungs.
think I've ever seen her so quiet before. So you checked her heart, her lungs. What's next?
And the pulse, to be sure that everything is fine. We're making notes about the respiratory rate and the heart rate, and the pulse is perfectly fine.
So when you're looking at the coat of an animal, is it
It has to
the
be shiny.
shine, the
It has to
color?
be shiny.
And what would some of the red flags be if the coat was not shiny? What would potentially could be the problem?
It could be hypovitaminosis, or it could be a skin issue. So you are checking also the skin to be sure that everything is fine, and we have to be sure we're asking if you have seen any dry skin issues or itchy feeling or something. You're going to say yes or no, and then we have to consider, look, her belly, for example, it's perfectly fine. Pink color, nothing to be worried about. She was paid. So then we're going to the abdomen. We have to palpate.
So talk to us in normal speak. What does that mean to palpate?
I'm just checking and feeling with my fingers if there is something wrong, meaning something that it shouldn't be there, like a foreign body. Don't forget that they are chewing and they are swallowing whatever sometimes. So you're checking close to the stomach, she's not responding, she's perfectly fine. I'm going towards her bladder, nothing, everything is perfectly fine except that she wants to pee. Her bladder is full.
It wasn't when we got here.
Now it's almost full. You have to walk her. Okay, last but not least, should be done before, but she's going to argue. I have to take the temperature.
So what you're about to do right now is take her temperature, and this would tell you what exactly.
If everything is fine, yeah, because it could be false temperature, it could be because of stress. She could have temperature in general. So the normal temperature for dogs, I'm talking, is in between 38 and 39. So if we see a dog that has 40, for example, but no clinical signs, we're going to say that let's wait for a while, let's be calm, because it could be due to stress, and then we're checking. If there are any other clinical signs and we have also temperature, that means that something's wrong. May I?
Okay, Kiki, this is the big moment.
Thank you.
Okay, so Kiki is about to get her temperature taken.
But unfortunately, it's not like humans.
Be very quiet.
Yeah, sorry. Excuse me.
You're 12. Kiki is really taking one for the team here.
And her temperature is perfectly fine, 38.2.
So that brings us to the end of a consultation.
A simple consultation.
Very simple consultation with Dr. Manos from the Modern Veterinary Clinic. We brought Kiki, our Chihuahua Pomeranian, who came to get her checkup so that our aspiring veterinarians could understand what a veterinarian does on a normal consultation with a furry pet when they're just coming for their annual checkups. Dr. Manos, how can we find you if we wanted to bring our pets to the Modern Veterinary Clinic? Where can we find you?
Just call MVC and ask for me.
So we have 3 branches, correct?
Main branch in Wassel, GLT branch, and the newest one, JVC.
In JVC.
And I'm here.
That brings us to the end of a really fun, very different spotlight today. We came to the Modern Veterinary Clinic here in JVC where we met with Dr. Manos, and our very own Kiki was lucky enough to have a consultation session so that we could be helping our aspiring veterinarians understand not just what veterinarians do at a consultation, but why they do it. I'll look forward to seeing you all at our next DESCareers at Dubai English Speaking College on the Road Spotlight.